The proposed definition of NANDA is an attempt to try and include in the NANDA taxonomy a type of nursing focus or nursing problem that to date it has not been a nursing diagnosis. My work specifically identified that as a collaborative problem 20-something years ago, maybe 86, so it's 30 years ago. I took the position that all diagnoses that nurses make and treat and have a responsibility or accountability for are not nursing diagnoses, that there's another group called collaborative problems. In my work up until this last edition, I labeled them as potential complications. Potential complications cardiovascular, potential complications respiratory. About 2 years ago, an article was published in NANDA about a different type of nursing diagnosis called surveillance. Surveillance diagnoses were proposed as a type of problem that nurses had as their major accountability to monitor and then respond to changes in the patient's condition. Similar to what I call collaborative problems, but not the same. NANDA, in its proposal for a change in the nursing diagnosis definition, have added monitoring and surveillance to the definition in hopes to perhaps take what I've called collaborative problems, what someone else may call surveillance diagnoses, although they're not listed anywhere. The concept is presented in the article, but they're not listed anywhere. And put them under the NANDA, in the NANDA classification system. I am opposed to naming medical diagnoses in new terminology and then calling it a nursing diagnosis. To me, it certainly doesn't add clarity, and because we now change the name of something called cirrhosis of the liver or myocardial infarction, doesn't change the fact that that is still not a nursing diagnosis. The dilemma that we have had for over 30 years is all nurses will agree that nurses have responsibilities and accountabilities to pneumonia, to diabetes mellitus, to bleeding, to hemorrhage, to cardiac problems. We all agree on that. The question is, how do we incorporate that part of our practice into nursing diagnosis? And the question is, or should we? My recommendation has always been in my work is to look at NANDA nursing diagnoses as different than collaborative problems. Collaborative problems do not need to be developed by NANDA. They're already well established in the literature. They come from medicine, and they have nursing and medical responsibilities. The North American Nursing Diagnosis Association International, NANDA-I, should continue in the business of developing and refining nursing diagnoses that are not on the list and those that are on the list that need to be researched and refined. So there still is the question. We all agree that there's this group that is predominantly not on the NANDA list that is critical for nurses in the care of patients. The question is, should we call them a nursing diagnosis, or should we call them something else, for example, what I do, collaborative problems? When we met in Miami in November of 2008, there was again a proposal for a change in the definition, and it was the one that you mentioned. It was not very well supported. I presented a recommendation paper at that conference. And one recommendation I made was perhaps we can call these collaborative problems risk for complications of, and that would be different than a risk nursing diagnosis. And if we did that, we could redefine that particular type as a collaborative nursing diagnosis. And it wouldn't have to even be called collaborative nursing diagnosis. It's just that it would be a different type of nursing diagnosis because that particular diagnosis needs medical and nursing interventions for successful outcomes. Whereby in nursing diagnosis, the others, risk, actual, do not. The reason I recommended that is because there's still a group of people, how many I have no idea, who believe that the most important focus for nursing is nursing diagnosis. I don't agree. I think the most important focus for nursing is either nursing diagnosis or the collaborative problem, depending upon what's wrong with the patient. But if we are going to continue to be at this wall because somebody wants to, because the majority, and I don't know it's the majority, want this to be called a nursing diagnosis, then I'd say fine, call it this, but define it differently. My recommendation that I've always made in my work is don't call these nursing diagnoses. Okay. Yeah. Call the whole list conditions that necessitate nursing care. One of them are nursing diagnoses, the other ones are collaborative problems. Spend no nursing energy researching what collaborative problems look like. We already know that. You may want to look at some of the nursing interventions for them. That's fine. Spend our energy doing what we should be doing, and that's refining nursing diagnosis. Just this year, in November, we approved a new nursing diagnosis called dysfunctional gastrointestinal motility. What is that? I have no idea. I would have, with no hesitation, tell you that the use of nursing diagnosis in Spain is far superior to the use of nursing diagnosis in the United States. In Spanish, in Spain, both nursing diagnosis and collaborative problems are used. And I have to say, and I have a bias, of course, with that because they do use collaborative problems, nursing diagnosis was more useful to them, it was clearer. They didn't have to argue where's diabetes, where's cirrhosis, where's post-op hemorrhage. It was always there. So when they developed their systems, their automated systems, they included both. There is a scholarly dialogue about nursing diagnosis in Spain that doesn't happen enough in the United States. And the conference that was held here would not have even been considered in the United States because it would have not been in the interest.
Thank you so much.
You're welcome. My pleasure.